Hello everyone, and today we are going to discuss psychology of health and well-being. We know what is health, we know what is psychology, right? Health means we have different definitions like free from illness, free from injuries, or a state of complete well-being, right? And if I asked what is psychology, that also you will say easily study of mind. So in this video, we are going to discuss what is psychology of health and well-being, or what is the role of health psychologist. So that we are going to discuss in this video. So what is health psychology? The study of health psychology looks at the interplay of biological, social, and psychological variables in health and disease. In order to improve healthcare system, prevent illness, and promote health, and health psychologists apply psychological science. So we are applying psychological science in health psychology to make the person to understand what is the actual meaning of health promotion and illness prevention. So, in health psychology, the study of health psychology looks psychological, social, biological variables affect health and illness. The health psychologists will look all aspect of health. They looks at how psychological, social, biological variables affect. So health psychology means don't get confused that we'll only look the psychological aspect of health. No. The study of health psychology looks at how psychological, social, and biological variables affect health and illness. Health psychologists apply psychological science to advance well-being, stay against disease, and enhance healthcare delivery network. So their duty, they means health psychologist duty is to enhance the healthcare delivery networks by providing proper information regarding psychological, social, and biological variables which affect health and illness. So this is health psychology. Now we are going to understand in details of what is health psychology. Health psychology explores those motivations in the pursuit of getting people to understand health promotion and illness prevention. That is the responsibility of health psychologist, or health psychology explores those motivations in the pursuit of getting people to understand what is health promotion and illness prevention. The specialty area examines how biological, social, and psychological factors influence the choice we make about our health. Health psychologists study the factors that allow people to be healthy, recover from an illness, and or cope up with chronic condition. So they are like all rounders health psychologists. They will make us to understand the all aspects of health and well-being. They are experts in the intersection of health and behavior, like intersection of health and behavior are in demand as a part of integrated healthcare delivery system, and they are working with our doctors or any other healthcare professional or medical doctors to provide whole person healthcare. So what is the role of health psychology? Means health psychology will help us to understand what is the ultimate meaning of health promotion, and they means health psychologists are working with other medical doctors, psychologists, therapists, or other specialist people to provide whole person health care. So, health psychology is the practice of motivating people to make health conscious decisions like not smoking, eating right food, and exercising more to prevent illness. Health psychology also explores what motivates people and explores why some people make healthy decisions and sometimes. So, they are doing research in that. We are different, we have different taste, we have different behavior, we have different characters. But when it comes to health, everyone need to think in the same way to maintain an ultimate health, to develop a good healthy community. So healthy psychology or health psychology also explores what motivates people and explores why some people make healthy decisions and why some people are not making, or some don't make or not making healthy decisions. Health psychology examines how the following factors influence your health. How the following factors influence your health: biological factors, social factors, psychological factors. Health psychologists also design and evaluate treatment plans to help to reduce your risk. What risk? Disease risk, improve outcomes, and improve your quality of life. So their ultimate role is to improve the quality of life. So the ultimate role of health psychology or health psychologist role is what? If someone is asking, means you have to say their ultimate role is to make the person to understand what is the meaning of quality of life, how you can achieve quality in your life, how you can become more productive by showing quality. Then, now we will see some more detail, like some examples. So if I give some example, you will easily understand what is health psychology. Health psychology looks at how the mind and body are connected in health and illness. Hope you know the theory by Sigmund Freud. There is a strong relationship between mind, body, and body, mind. Mind, body, and body, mind. If your mind is not good, the body will not work. Your body is not good, your mind will not work. So health psychology looks that aspect at how the mind and body are connected in health and illness. Examples of how health psychology can help include providing intervention, that means planning when some feels large amount of anxiety and experiences stomach problem. So if you have stomach problem, chances of anxieties are there. If you have anxiety, there are chances of stomach problem. So they will examine how they are interrelated and will help to find out the solution. A medical doctor cannot interconnect these things and give treatment for both of this. A psychologist cannot give treatment for both of. They will refer the stomach problem to the medical doctor. The medical doctor will refer anxiety to the psychologist. But health psychologists will interconnect both things and will integrate, will collaborate these two group people and will help the person to find out a solution. A health psychologist would look at what causing the headaches or stomach problem. Is the anxiety causing this problem? Does the individual have this problem continuously? Okay. Does the individual have anxiety from persistent stomach problem and headache? They will try to interrelate. They will do proper examination, like by asking questions. They will find out the answer. Is the anxiety causing this problem, or does the individual have anxiety from persistent stomach problems or headaches? And maybe the patient worries that headaches and stomach issues are symptoms of more significant issue. So they will work with the client or with the patient to find out the actual reason. Stomach issue is due to headache, or headache due to stomach problem, or it is an indicator of some other problem. Another example include help you to look at your psychological stress and helping you to avoid stress eating. So they also will focus on stress and how to avoid stress eating. The psychologist will help you to think about exercising to reduce your stress. So these are all some job roles of health psychologists. Health psychologists primarily work in clinical settings. So you can see the health psychologists in the clinical setting. They conduct clinical interviews and behavioral assessment. They can work with individuals or with group. Health psychologists conduct research, and that can help you to evaluate healthcare cost also. Healthcare that help healthcare person, or that help healthcare decision makers and policy makers to decide in a proper way. Some health psychologists study the cause of health problems and how they could be prevented. And they also research why some people don't get care and why they are not getting it. So they are like all rounders. The health psychologists are working with everyone. They are working with the professionals. They are working with patients. They are working with the policymakers. They are working with the decision maker. They are working with the financial aspect. They are working with the economical aspects also. So they are like all rounders. And you can see them in the clinical setting. They'll work individually as well as they will work with the group. And what do the health psychologists investigate? They are looking at factors in person's lives and what driving it, behavior, and how they can help them select a path leading towards illness. The psychologist identifies the link between people's emotions, behavior, and consequences on their lives. And making good health choices is the first goal of a health psychologist. So what is their basic job role means? They will help the person to find out the good choice, depend upon their situation, depend upon their financial status, depend upon their social status, depend upon their psychological status. So they will look into each and every factors and how they can help them to select a path leading towards wellness. How is health psychology is unique? Because health psychology stresses how behavior influences health. They are unique because they will stresses how behavior influences health. Health psychology researchers conducting study on how to prevent unhealthy behaviors such as smoking or to find new ways to encourage healthy actions such as exercising. So they will study both smoking. If someone is smoking, they'll study the reason behind smoking. At the same time, they will encourage the patient to take actions against smoking, stop smoking, do exercises. As psychologists look at the psychological factors that influences the health choices and explores way to motivate people to make better health choices. Health psychology in practice. This discipline of health psychology is expanding quickly. Nowadays, health psychology is having a lot of scope. Previously it was not like that. There was a medical doctor, there was some psychologist, there was some occupational therapist or speech therapist or language therapist or a recreational therapist, but now we have health psychologist also to integrate all these things to make everything under one umbrella to lead everyone in the same direction. This discipline of health psychology is expanding quickly. A growing number of people are looking for the health related information and tools as they attempt to take charge of their own health. As psychologists are well suited to meet this growing demand because their primary goal is to educate individuals about their own health and well-being. So basically, health and psychologists are not giving any kind of medications. They are not giving any kind of therapy. They are educating. They are giving awareness to the people. So this is your situation. So you are standing here. Or in another way, we could say that they will make us to do a self-reflection. They will help you to reflect yourself. They will help you to do a reflection on yourself. They will help you to understand what's your strength, what is your weakness, in which position you are standing, what is your health status, what is your emotional stage, what is your psychological stage, how much weak you are, in which aspect you are weak. Either you are weak emotionally or physically or psychologically or socially, culturally or spiritually. So the primary goal of a health psychologist is to educate the people about their own health and well-being. And there are different branches for health psychology, for example, like clinical health psychology, community health psychology, occupational health psychology, public health psychology. So if you see these branches, you can see where they are sitting. They are sitting in clinical setup. So along with a psychologist, you can see clinical health psychologist. You in community setup, you can see health psychologist. Occupational therapy department, you can see health psychologist. Public health department also, you can see health psychologist, but the names will be their designation will be different. So health education department, there's a department will be there. Health psychological psychologists will be there in that department to understand your behavior, to learn your behavior, to educate you, to guide you, to make you to go to the right way, to take the right choice, to help you to reflect yourself. So this is health psychology. So hope you understand. Health is different, psychology is different. Health psychology means it's a collaboration of both health and psychology. And health psychology is focusing on all aspect of health: behavioral, social, emotional, psychological. And the psychologists are focusing on the behavioral aspects. Not only the psychological aspect, they'll focus on all behavioral aspects. Okay, all type of behavioral aspects along with their social, biological, and psychological aspects. So basically, or in conclusion, I would like to say that health psychologists will help you to understand who you are, will help to they will give education. So what's the primary goal of a health psychologist means? The primary goal of health psychologist is to educate, to teach what is right, what's your present status. Hope you understand, guys. Thank you for listening. Okay, and next time with another video.